Good afternoon. My name is Wei-Ping Ren from the Department of Biomedical Engineering. Our product is a bone cement for the repair of the bone defects. Our team composed of postdoc fellow in my lab and myself, and also we have a CEO who has the business background and also have the MBA degree. And also we are building a scientific advisory board, which is mainly composed of the surgeon and the dentist. There are two main limitations of the kerosene phosphate-based bone cements. The first one is the mechanical weakness. So that's why these kind of bone cements cannot be used for the load-bearing bone defect and also the large bone defect. The second limitation is the poor cohesion. The poor cohesion also in some book we call the anti-washout. There's also a headache for the surgeon. Why? Because when we inject the bone cement into the bone defect area, so these kind of bone cement granule will be washed out by the blood and the body fluid. So not only this kind of granule not only damage the surrounding tissue, but also will get into the bloodstream. So this always have some clinical report. So if they get into the bloodstream, they will block the blood vessel. If block the blood vessel in the lung tissue and the heart tissue, the patient will die, even die on the operating table. So that's the big headache for the surgeons. So that's the main problem of this kind of product. So our product can provide some solution. Our solution is simple because we provide the solution by providing a completely different way to manufacture the kerosene phosphate cement. That's completely different from the classical way. So our solution is also strong. Why? Because we solve the two problems at the same time. So these are problems already in the market in the past 40 years. Okay. So because of that, so I think our product can meet some unmet clinical needs, as I mentioned, for some complicated case, for example, the large bone defect and the weight-bearing bone defects. So who will buy this kind of product? Actually, the hospitals and also the surgeons in the private practice. When they do the bone defect healing, they need this kind of bone cement to fill into the bone defects. So the merit of our product, as I mentioned before, that means the unmet clinical need. Just like a load-bearing bone defect. A load-bearing just like spine, hip, and the knee, long bone defect. And also the larger bone defect, that means more than 25 centimeter square bone defect. And also with the better clinical outcome. And because with the better clinical outcome, that means the revision will be less. In that way, the cost will be reduced. So the market size, there are 2.2 million patients who need to do the bone defect surgery every year worldwide. 1/4 is in USA. So the market size actually is the $3.3 billion every year. So in this market segment actually can be divided into two parts. One is the non-load-bearing bone defect that can be solved by the classical kerosene phosphate cement. Another one is the load-bearing bone defect. That's the big problem. So far, no single commercially available kerosene phosphate cement can be used for the load-bearing defect. So we hope our product, after FDA approval, this one might be the first one can get into this load-bearing bone defect market. Regarding the competition, as I mentioned, the unique property of the PolidBone, so it's much better than the current classical commercially available kerosene phosphate-based bone cement. So we compare the performance of our product with the current available commercial products as shown in this table. So first of all, we just look at the surgery time. So we can just reduce the surgery time half. That means we can save the time of the surgeon and also the patient. It also means some kind of the cost reduction. And also, mechanical strength of PolidBone, our product, is much stronger than the classical one. So it's around 3-fold high mechanical strength. That's why our product can be used for the load-bearing bone defect. And another excellent property is the excellent cohesion. So if we inject our bone cement into the water, they're just like a toothpaste, no displacement. So that's really amazing. So another beauty of our product is the simple composition. That means our product is only composed of the calcium and the phosphate. So we know that calcium and the phosphate is the components of our bone. That means our product is 100% of nature things. That means what? That means we may be easy to get the FDA approved because no cross-link, no other polymer are involved in our product. So regarding to our commercialization plan, we already formed a company. We are now discussing with the Wednesday to get the licensing our technology to the company. So the next step, we just do the product performance testing following the ASTM stand. And then for this testing, data from this kind of testing will be used for the FDA application. So as soon as we get the FDA application, then we can move to the next stage, is the commercialization, including the clinical trial and the marketing. So at the same time, we also can just start the licensing, a partnership discussion with the bigger companies. So for this part, the critical part, I think the AI funding will be really helpful to move this step fast. So what we have done, actually we already developed a prototype product called PolidBone. And also we already submitted the PCT patents, 2 PCT patents. And also we did the marketing validation. We did 2 surveys. One is the clinician survey. And another survey is from the industry survey. All the feedback is very positive because the surgeons really like our product, including the Detroit Medical Center. They said they really want to use our product if this is FDA approved. And the feedback from the industry is the one thing the same. They said our technology will have a big impact for this industry. And also we already started the discussion with some big company, for example, the Stryker and the Johnson & Johnson. They are reviewing our product. So that's the funding request and the milestones. So actually we are requesting total $70K for 1 year. And this money will be cover 3 planned work. The first planned work is the most important work. We are requesting $60K to validation of our product performance using an IM nail model. And the detailed budget, just like around 37K will be covered 2 key personnel in my lab, and the rest, around 22K, will be covered the material and the supplies and some kind of a service charge. So the success criteria is we want to use this money to validate the best formulation of using this model, because this kind of data will be critical for the preparation of the product summary form for the application of FDA approval. We are also requesting $6K to start the FDA discussion. We want to hire an FDA agent to help us to prepare and the submission of the FDA application package. So we hope that the agent can help us to initiate the first meeting with the FDA, because that's really critical before we spend more money to prepare some data. The third part of our work, we are requesting $4K to cover some business trip to go to the on-site presentation of our product. Because we have the defined company, including the Strucker and the Johnson & Johnson, because we already have several phone conference and the webinar conference with them. I think it's better we just present our product on site and then face-to-face discussion. In that way, maybe increase the success rate of the licensing or different format of the partnership. Thank you.